Diabetes is seriously becoming a severe chronic condition all around the world. We need to discuss diabetes in Africa, where a lot of countries deal with a double disease burden.
Every morning, my mom has to come and wake me up to see if I'm alive.
Over 2 million people live with diabetes in Ghana. Out of that number, more than 7% are adults with type 2 diabetes. Welcome, Issaka.
Thank you.
Just before this conversation started, I noticed you were pricking your hand and checking your blood sugar. How often do you do that?
I usually do that about 4 to 5 times in a day.
How long have you been living with diabetes?
I've been living with diabetes for the past 15 years, so I think 20th October will be my 16th year.
When was the first time you got diagnosed?
That was 2009, that was 20th October. So I was feeling very weak. I was having dehydration, always feeling very tired. I have a very dry skin, but then within that time, I didn't know I was having diabetes. I didn't know anything about diabetes, neither my family. We were in the dark and then just treating myself with sometimes herbal medication and then all that.
Okay.
Until I went off one day and then I found myself in the hospital at Kolebu.
So when you say you went off one day, what do you mean?
I felt unconscious. I would visit the washroom for like 9 to 10 times just in the night. I missed school for the whole term. Diabetes
is one of the top 4 most common non-communicable diseases in the world, causing illness and death. And experts have projected the number to increase by 50% in 2045 in sub-Saharan Africa. 830 people in the world are currently living with diabetes, and over 75% of them actually live in low and middle income countries like Ghana. How has it been all these years living with diabetes for you as a person?
I have to check my sugars, that's the FBS, my fasting blood sugar, and then I correct it.
What do you use to correct it?
If it's low, I correct it with sugars. When it's high, I correct it with the insulin. So we have different types of insulin.
Okay.
Mixed, which works for 12 hours. And then we have a long and then a short acting.
Okay.
Yes. So we take the long acting, that's in the morning and in the evening. And then we use the short acting for the meals. Anytime you have to take anything, you have to take the short acting.
The short acting.
Yes. I eat more of vegetables, your medication, and then exercise.
So let's jump straight into the DW Africa community to answer some really important questions. Asen Cham from Gambia. What is the normal range for a random blood glucose test? If you're using milligram per DL, you're looking for 70 to 140. That's considered normal. If you're using millimole per liter, you're using 3.9 to 7.8 as normal. Alan Kalumba, who is from Uganda, must every diabetic administer insulin shots? I'm so glad you asked that. Well, there are 2 kinds of diabetes. There is the type 1 and there's a type 2. For type 1, it means that the person is insulin deficient. So that is the kind of diabetes that requires insulin shots. If you're a type 2 diabetic, in other words, your body is just resistant to the insulin that your body is normally producing, you might not necessarily need insulin. So what do you usually notice when you're having this hypoglycemia?
You feel shaky, you feel dizzy, you feel confused. You start to feel like you are not yourself.
Let's share a few facts about diabetes. The first is that diabetes is not curable. However, with the right medication and lifestyle changes, it can be properly managed. If a pregnant woman manages her diabetes properly, she actually stands the chance of having a very healthy pregnancy. Who helps you in those difficult times?
My family, especially my mom. Every morning, my mom has to come and wake me up to see if I'm alive. Because hypoglycemia really hits in the morning.
How would you help people who are watching this now living with diabetes?
To try and then advocate for themselves, because the awareness in the country is very less.
Thank you, Issaka, for sharing this story with us. And if you're watching this and you know someone who's living with diabetes, or you are actually living with diabetes, I'm sure there's a lot you've learned today. Don't hesitate to share this video, put in the comment section whatever you think we must have missed out. And until the next episode, this is Healthy Me No Cap.